Thank you, and welcome Wakefield to another one of our COVID updates on our last Friday in September. Believe it or not, next time we meet, it'll be October, and then before we know it, um, we'll be well into the winter season. So there's probably lots of things to talk about because as the winter comes about and people are more indoors, more huddled, and can't get outside, there are certainly the possibility that there is an atmosphere that's much more conducive to the spread of any virus. So moving right on, I guess we did not scare our health director away, Anthony Choi, who is here, and he can certainly bring us up to date on some of the goings on. So Anthony, the floor is yours.
Great, thank you, Steve. So I just wanted to go over a little bit of the situation going on in Wakefield right now in terms of COVID, go over some of the numbers. Right now, we're looking at a slight decrease since last week. So we're looking at the average daily cases. We've had a slight decrease to 3 cases per day, down from 4 last week. Currently, we are only seeing about 94 active confirmed cases. So we're doing a good job in terms of contact tracing. We're following up with a lot of cases, and we're making sure that individuals are testing on a regular basis. One of the things that we have been talking about recently has been the vaccination rate for certain age groups. And so one of the groups that we've been focusing a lot of our messaging on has been the 20 to 29 years of age. And so we want to make sure that everybody is doing their part and they understand that heading into this fall to winter season, we're hoping to avoid the trends of last year. And so by getting vaccinated, you're not only protecting yourself, but others as well. And working closely with our superintendent, Doug Lyons, the schools here in Wakefield have been doing a great job in terms of tracking students that are positive and making sure that teachers are also staying safe as well. We've seen a decrease in the number of quarantine students, and Doug will go into that a little bit later. And in terms of the positivity rates here in Wakefield, we've been seeing a slight decrease in positivity. So what we want to do is make sure we stay in line with consistent testing over time, and to make sure that individuals who are not sure will go out and get tested, with PCR still being the gold standard. One of the things we wanted to bring up in terms of an update was the implementation of symptomatic testing and test and stay in schools starting Monday here in Wakefield. And so this is in line with the DESE guidelines as a Department of Elementary and Secondary Education. And so with their guidance and their regulations, for those who don't know, symptomatic testing is for individuals who are at school and present symptoms of COVID. And the disclaimer is that individuals who have symptoms outside of school should not be going to school. So they should stay quarantined and they should go out to get tested. The symptomatic testing and test and stay programs will be relying on the Binax Now rapid antigen test. And so hopefully with this program, we're able to track close contacts, as well as a test and stay is actually a program that's focused on close contacts. This is going to be a program where 2 antigen tests are administered in subsequent days from the point of contact. And hopefully with this program, we're able to keep students safe and try and have students stay in class. So that is all the updates we have for the Wakefield schools. Thank you.
Thank you. Thank you very much, Anthony. Wonderful. Superintendent Lyons, again, congratulations on getting the kids back in the classroom. Very important. And I know that you are certainly thrilled with that and facing all the challenges. So maybe you can give us a little update on how we're doing.
Certainly, we are thrilled to have another full week in school and kind of pre-COVID in-person schedules. You know, we're not taking for granted any days that we can get in. So we're very pleased about that. Just to kind of build on Anthony's comments, you know, first of all, our vaccination coverage in Wakefield continues to be really strong. I know Anthony's focusing on the 20 and up group where the numbers are dipping there with vaccinations. We are looking at and keeping track of the 12 to 15-year-old age group and the 16 to 19-year-old age group. The 12 to 15-year-old age group took a little tick up this week. We're up to 76% of all of the students in that age group that are eligible to be tested, we're up, 1% from last week. It's about 12 students. It's in the positive. We'll take it, right? Incremental gain at this point is critically important. The 16 to 19-year-old age group is stable at 88%. Again, we need to qualify that number by kind of setting a context that not all of the 18 and 19-year-olds are in our system. Many of them are in private colleges and in public colleges where testing and vaccinations are required. So that's a piece about vaccination. So we continue to be strong in that space, but we need to be better. As we approach October 1st, an important kind of number that we're shooting for is this 80%. If you recall, a few weeks back when the state came out with their mask mandate, a reference that they had made is from the Commissioner of Education. He had said that a number that we're shooting at that we will use to reassess whether the mask mandate will continue or not is 80% of an entire school community, reaching that 80% mark in regard to vaccination rates. And so we're still kind of lower than we would like to be with our student numbers. And we will be working on collecting faculty and staff numbers this coming week. The department has also said, that is the Department of Elementary and Secondary Ed, has also said that they will be publishing a formula of how they will derive the 80%, likely either this afternoon or early next week, because I'm sure it will be a point of conversation in their meeting as well. Also, as Anthony noted, we will be starting both symptomatic testing and test and stay on Monday, right? Our nurses went through training this week with CIC and the Department of Ed. So I feel like we're in a good place, and which will also address our COVID numbers and will kind of bring them down for parents who have given consent for our students to test. A question that I got yesterday on our parent call was, can I provide a number of students that are participating in these testing programs? The state average is around 30%, and we're kind of at about close to 60% at this point. We have about 1,700 students that are participating in the symptomatic testing and the test and stay programs. And so it's also important for me just to reference the quarantine numbers for this week. We are at 125 cases, or 123 students in quarantine, 2 adults, 125 total. And so we also have 13 positive cases. The positive cases are, we have 1 at Dolbear, 6 at Galvin, 2 at Walton, 2 student cases, 1 adult case, 1 adult case at the high school, and 2 at Woodville, for a total of 13. The 125 in quarantine, the breakdown is as follows: 3 at Dolbear, 9 at Doyle, 63 at Galvin, 8 at Greenwood, 21 at Walton, 15 students and 2 adults at the high school, and 4 at Woodville, for a total of 125. That's 123 and 2. We will be sending out that data as part of our weekly correspondence as well. Just one more note about the test and stay. We've gotten some questions, and I just want to clarify this. Parents have asked, so if I have an elementary age student and they are participating in youth sports on the weekend, can my child participate in test and stay? If they're participating in an event that is not a school-sponsored event, they cannot come back into school and participate in test and stay. Our nurses, unfortunately, will have to kind of ask you to pick up your children and have them tested outside of school. And so I'm sorry to report that, but we need to adhere to the guidelines because we don't have the capacity to build out a testing program anytime any student becomes a close contact. And as we move into winter and the flu season, we feel like it's likely that symptoms are only going to increase, and we're going to need to be judicious in regard to how we're managing these situations. But if the cup is half full, we have another full weekend. We're getting better. Kids are settling in, adults are settling in, and we're very pleased to be back at it. So thank you for the time.
Thank you, Doug. I did see that Council Chair Julie Smith-Galvin jumped on. Let me see. Julie, you there? If you want to say a few words.
Oh, I'm not going to take much time. This is way more important, but just thank you so much. Welcome, Anthony. I haven't had a chance to meet you yet, but we are thrilled you are here. Doug, I know you're doing yeoman's work at the schools, and we thank you for that. So just keep up the good work and don't let us politicians get in your way.
Great, thank you. Tom Walsh. And then I'll jump back to the.
Good morning. I just want to reiterate some of the points. It's the emergency management people that their primary concern is safety. So right now, our message is just get vaccinated. Get out there, get your vaccine shot. If you're eligible to get a booster, get the booster. You know, there's no coincidence that there's a direct correlation between the states with the lowest vaccination rate have the highest problems right now. So you can see that. So all we're doing is pushing forward. Also, I ask people to still be vigilant when they're going out places, because it's no crime to wear a mask. If you go into a crowded grocery store or a restaurant, you know, it's not wrong to say, you know what, I think I'll put a mask on, or maybe I'll come back. And those are the things that you should be looking at. We're still trying to keep people safe, and that's the important thing right now.
Thank you. Thank you very much, Tom. And I did want to also acknowledge that Vice Chair of the Town Council, Maureen Butt, is on, and she is anxiously monitoring all of this, but has said that thankful everybody for their work, but that she does not need to come on the camera. So thank you, Maureen, for all your support. We do have a Board of Health member here, Laurel Gorval. Laurel.
Good morning.
Joining us.
We've had our first meeting with Anthony officially this week, so our session has started. We hope it's a long tenure. Again, you know, back to the town's effort, it is, as Julie says, yeoman's work. I am incredibly impressed at team school nursing. I don't think we have ever been so tightly aligned and asking so much of them. And so, you know, don't forget that in pediatrics, school nursing has just become more and more vital as we have kids with chronic illness who may be more susceptible joining in school. And that, you know, that's what we want, but it is incredible work. So, you know, I do hope that the public is appreciating the work that we do. We're still continuing, you know, we have colleagues who are working on the contact tracing. I think people know this. I'm trying to rack my brain on the gap of information out there. And there was a fabulous interview with the director of medicine at UMass Medical, because the middle of the state is doing actually quite poorly. Presently in Maine, they're in a little bit of a panic up here with full beds. So I think, you know, again, of my colleagues who are absolutely, you know, endless in this, and be patient with people who are vaccine hesitant and try to figure out what it is that is driving that, because it's, you know, I can't blame people who are being bombarded with disinformation. So I think that we need to back off of the us versus them and try to just keep pushing. And in public health, we just have to change the messaging so that it's heard. I haven't done my job with the patient unless I understand what I'm saying. So that's my tidbit for today. Flu vaccine clinics are about to be announced, and it's vitally important that we're strong on that campaign this year. Again, you know, a person who would be exposed to both viruses, I can't imagine how sick they could be and what our numbers would be. Our mortality rates across the country for COVID are so frightening and are absolutely changing the trajectory of what our world population is looking like. So keep up the good work, Wakefield. Good job.
Great, thank you. And thank you for all the support of the Board of Health here. Speaking of vaccine clinics, Jen, do you want to give us some dates I know they're all posted, but never.
Sure.
To,
So this weekend, there's an event called Oktoberfest by the lake. And there will be a pop-up COVID vaccination clinic that the Health and Emergency Management departments have organized. It'll be Cataldo Ambulance that will be down there. They will accept walk-ups, or you are free to register in advance. So that's a COVID vaccination clinic. A lot of people are also asking about flu clinics, and I am hopeful that I will get the registration links today to put out something a little bit more formal, but just mark on your calendars. October 2nd, there will be a pop-up flu clinic on the Common. That's the same time as the Festival by the Lake, so you can go to that event and pop over. It is a 19+ clinic. And then October 21st, there will be another 19+ clinic at the Galvin Middle School. I know that Anthony and team are trying to work through whether they can have a family clinic a little bit later in the fall, but a date has not yet been secured for that.
Great, thank you. I do want to touch on something that Anthony talked about before about the PCR test as being the gold standard. And I do know that you can go to your local pharmacy and get a test that you can buy off the shelf and, check it on your own. But really, those are not as accurate as we would like. So if you think you've been exposed or you're feeling symptomatic, what have you, go and get the PCR test. You can get it very quickly. You can go to any of the urgent care places, and you'll get your results within an hour. Normally, I have within an hour when I went a couple of times. So that's the gold standard. We really would encourage people to do that, to really be much more sure about your results. So please, that's what we do to our personnel here. So I think the community should do it too if they've been exposed. I did see Steve Ingalls on, our #1 fan from the school committee. Steve, did you want to add anything?
I would maybe just two quick things to Tom's point about where, people should feel comfortable still wearing masks indoors if that feels appropriate. You know the venue that you're going into. So if you feel like that's one where you're safer, there's nothing wrong with that. I would also echo in crowded places, even outdoors. I know mitigation strategies has always been a 2 of 3 thing. So outdoors is great, but if you find yourself in a compact place, and we have opened up some venues to different things, just if you're in a group of people that you don't necessarily know and it's tightly packed, sure, put on a mask if that's good for you. For us, we have small children. We kind of go by that rule. And honestly, I don't think there's anything wrong with that. And then just also in Doug's mentioning of the test and stay, if you're doing outside activities, that was, again, if you're doing an outside of the district extracurricular activity and you end up being a close contact from that unfortunately the resources within district aren't large enough to handle everybody that's a close contact. That's accounted for inside the district, and there's placements in for that so that we can do that test and stay program, but it can't handle like everyone that's a close contact that goes to school that is a close contact and extracurricular activities. If I'm reading that right, correct, Doug? Yeah, so just that, and aside from that, just always just thank you for everyone that puts in all the work on this. I think Wakefield's looking great, and I know it's due to all the work that everyone's putting in, so it's appreciated.
Okay, thank you very much, Steve. I'm still throwing out my challenge to the men in town. You are still 10+% behind the women. They're showing they are way smarter than we are, particularly in getting vaccinations. Something that's been drilled into my head since my first sister was born about 58 years ago. So please, get vaccinated if you haven't. Be safe, particularly when you go away to some family events. I mean, a lot of people postpone their weddings, and we're going to see a slew of weddings coming up, and people will be coming in from all over the country in some cases, in areas where, there is not the high level of vaccination rate as there is in Massachusetts. So if you're going to a wedding and someone's coming in from, let's say, Florida, where we've all heard about that, or anywhere else, be careful. There's nothing wrong with wearing a mask in the wedding so you can protect yourself and protect your other family members. And you can still have a good time. So unless anybody had anything else, stay safe this weekend, and we will see you next week, hopefully continuing to report positive trends. Anybody have anything else? No? Okay, have a great weekend, Wakefield. Thank you very much.